What if quitting smoking started repairing your body within the first 20 minutes? That's not a motivational slogan, it's biology. The moment a person stops smoking, the body begins a remarkable sequence of changes. And the first changes happen faster than most people expect. So what exactly happens in the first few minutes after the last cigarette? Within 20 minutes of quitting, the body begins making measurable changes. Heart rate drops. Blood pressure, which spikes with every cigarette due to nicotine's effect on adrenaline, begins to normalize. Blood vessels that have been constricted start to relax. This happens because nicotine is a powerful vasoconstrictor. It causes blood vessels to tighten, forcing the heart to work harder to push blood through narrower pathways. Without nicotine entering the system, that pressure begins to lift almost immediately. It's worth understanding just how frequently this cycle was repeating. A person smoking 1 pack a day is introducing nicotine into their bloodstream roughly 20 times every 24 hours. Each cigarette triggers a fresh spike in heart rate and blood pressure. The cardiovascular system never fully settles. It exists in a near constant state of chemical stress. Quitting breaks that cycle entirely, and the heart responds right away. The heart doesn't need days or weeks to start recovering. It begins within minutes. But what about the damage deeper inside the body, the kind caused by years of inhaling thousands of toxic chemicals? Within 8 to 12 hours of the last cigarette, carbon monoxide levels in the blood begin to drop significantly. Carbon monoxide is a toxic gas produced by burning tobacco. It binds to hemoglobin, the molecule in red blood cells responsible for carrying oxygen far more efficiently than oxygen itself does. This means smokers are constantly operating with reduced oxygen capacity. Their blood is partly occupied by a gas that their body cannot use. Over time, the body attempts to compensate by producing more red blood cells, but this thickens the blood and raises the risk of clotting. It's a workaround, not a solution. As carbon monoxide clears, oxygen levels in the blood begin to rise back toward normal. Cells that have been receiving less oxygen than they needed start getting a better supply. This shift has downstream effects throughout the entire body. Muscles function more efficiently. Cognitive clarity can begin to improve. Even skin tone can change subtly as circulation improves and oxygen delivery increases. Within 24 hours, carbon monoxide has largely cleared, and the blood is carrying oxygen more efficiently than it has in years. Here's where the timeline gets more surprising. What happens to the nervous system? Nicotine is highly addictive because it triggers the release of dopamine, the brain's reward chemical. Over time, the brain adjusts to regular nicotine exposure by reducing its own dopamine sensitivity. It essentially recalibrates itself around the drug. This is why withdrawal feels so difficult. In the first 24 to 72 hours, the brain is actively trying to rebalance its chemistry. Cravings, irritability, and difficulty concentrating are common during this window. Not signs of weakness, but signs of the brain doing real biological work. What makes this window particularly challenging is that the brain hasn't yet rebuilt its ability to generate dopamine responses from everyday experiences. Food, social connection, and physical activity all trigger dopamine naturally, but in a brain that has been relying on nicotine, those natural signals feel temporarily muted. This is a key reason why the first few days are often the hardest part of quitting. Research suggests that nicotine receptors in the brain begin to normalize within a few days to weeks of quitting. The brain, like the rest of the body, is working to restore its original baseline. Sleep quality, which is frequently disrupted during active smoking, also begins to improve as the nervous system stabilizes. The discomfort of withdrawal is actually evidence that the brain is in the process of healing. What about the lungs, the most obvious target of smoking-related damage? The lungs begin a quiet but significant process of repair in the days and weeks after quitting. The airways contain tiny hair-like structures called cilia. Their job is to sweep mucus, debris, and harmful particles out of the respiratory tract. Cigarette smoke paralyzes cilia. Over time, smoking destroys many of them completely. But within a few days of quitting, surviving cilia begin to recover function. They start moving again, clearing out the buildup that had accumulated. This is why many people notice an increase in coughing and mucus production in the early weeks after quitting. It's a common source of confusion. People assume they're getting worse. In reality, the lungs are actively clearing out damage. The body is essentially running a deep clean on a system that has been overwhelmed for years. By the end of the first month, many former smokers notice improved breathing. Lung capacity begins to increase as inflammation in the airways decreases. Physical activities that once caused breathlessness, climbing stairs, walking quickly, light exercise begin to feel easier. The lungs are not just passively recovering, they are actively rebuilding their ability to do their job. The lungs don't simply stop getting worse when someone quits. They begin an active process of clearing and repair. What happens over months and years? 1 year after quitting, the risk of coronary heart disease drops to roughly half that of a current smoker. The cardiovascular system, the heart and blood vessels, has had time to make significant structural improvements. Blood vessels become more flexible. The lining of arteries, called the endothelium, begins to function more normally. The risk of blood clots decreases. Circulation improves to the point where hands and feet, which are often noticeably cold in smokers due to restricted blood flow, begin to warm up as vessels fully relax and blood moves more freely through the body's smaller pathways. At the 5-year mark, the risk of stroke begins to approach that of a non-smoker. This is a remarkable shift, given that smoking is one of the leading risk factors for stroke worldwide. At 10 years, the risk of lung cancer falls to roughly half that of a current smoker. Precancerous cells in the lungs are gradually replaced by healthier tissue. The risk of cancers of the mouth, throat, esophagus, kidney, and pancreas also drops significantly. At 15 years, the risk of coronary heart disease is comparable to that of someone who never smoked. What began as a cascade of chemical damage has, over time, been systematically dismantled by the body's own repair processes. The 15-year mark isn't the end of recovery, but it is a powerful indicator of just how far the body is capable of coming back. The body doesn't just stabilize after quitting. Over time, it systematically reduces the biological risk that smoking created year by year. But here's something most people don't consider. Does this timeline still apply to long-term smokers? What if someone smoked for decades? Research consistently shows that the benefits of quitting apply at virtually every age. A person who quits at 60 still reduces their risk of smoking-related disease significantly compared to someone who continues. A landmark study tracking over 1 million women found that those who quit before age 40 eliminated roughly 90% of the excess mortality risk caused by smoking. Those who quit before 30 eliminated nearly all of it. But even quitting later in life produces measurable improvements. The cardiovascular system begins responding within days. The lungs begin clearing within weeks. The cancer risk curve begins bending downward within years. Each of these changes is real, measurable, and meaningful regardless of how many years the habit lasted. The body appears to carry a kind of biological memory of what normal function looks like, and given the chance, it moves back toward that baseline with remarkable consistency. The length of time someone smoked changes the starting point. It doesn't change the direction the body moves once they stop. Quitting smoking triggers one of the most well-documented healing sequences in all of human biology. Within 20 minutes, the heart rate drops. Within hours, oxygen levels rise. Within days, the nervous system begins rebalancing. Within weeks, the lungs are actively clearing damage. Within years, the risk of heart disease, stroke, and cancer drops substantially. And it all begins sooner than most people expect. The body doesn't wait to heal. It starts the moment you stop. And that process begins within minutes, whether you notice it or not.